So we're going to anesthetize this bird, so we're going to put him under full anesthesia just so we can get some radiographs or x-rays on this guy. So before we do that, I'm just going to take a quick listen to make sure everything sounds okay. So I'll listen to his heart and also listen to his air sacs and lungs. That's good. And I always check his crop, so that's an ouching in his esophagus, just where they can store food temporarily. Just make sure it's empty before we anesthetize. So for any procedure that's going to be longer, we want to make sure they're not stressed out, and so we put them under anesthesia, so that's essentially just making them go to sleep so that they are not aware of what's going on and their stress level is decreased. And so birds have really efficient respiratory tracts, and that allows us to use a gas anesthesia, so it's coming through the mask and delivered with oxygen, so that he'll breathe it in, he'll get sleepy and relax, and then it's very nice because they breathe it off really quickly, and so he'll recover quite quickly as well. And sometimes we use additional medications too for pain relief or additional stress relief as well, just to try and minimize the distress we cause these guys. Kind of a unique thing about bald eagles is sometimes they don't completely close their eyes during anesthesia, so they'll keep their eyes open, so it looks like they're more awake than they are, even though they're fully relaxed. This eagle came in, she was hit by a car, and she had some very severe internal trauma, so that's damage to some of the organs that we can see on x-rays. And so I'm just going to take a good listen to her to see if I hear any changes in her air sacs, which might indicate that she still has trauma in her internal organs. She's it's good. I don't hear any evidence of lung disease or anything like that right now. So for a physical exam on these guys, I always said they have a keel, so it's a pointy part of their sternum that their flight muscles attach to, and so I always feel that to get an idea of how well conditioned, if they are in good shape, and then I feel the bones of their shoulders, so they have a little bit of a different shoulder than people do. They have a clavicle like we do, but they also have a bone called a coracoid that helps support their flight muscles, and that all feels good. I don't feel any instability, so I'm going to extend her wing. A little tension there, so that might be painful. Okay. We're going to get full x-rays on her, so that we'll look for any additional injuries. We'll check her a little more closely when we get x-rays. So just look at her feet. Borrow this leg. So I'm just feeling for any swelling or any instability, like they have an injury to a bone or a ligament, and also checking for any wounds, which I'm not finding. Get that back to you. Okay, perfect. Sneak to this side. We always check their feet so that we can make sure there's not developing any foot lesions, which can happen when they're in a cage and not flying as much as they normally would be. So we're getting blood on this bird so that we can check her white blood cell and red blood cell counts. So we're looking for evidence. If her red blood cells are low, is she anemic because she has blood loss? Because potentially she has internal trauma. And then we'll also check if we see any elevations in her white blood cells, which could be evidence of infection. And then because, we believe that she had some severe internal damage from being hit by a car, we're also going to check what's called a chemistry panel. So that looks more at organ function. So looking at her kidney values, her liver values, to see if there's any changes that internally we can't see that are going on with her. So sometimes our eagles, they're a bigger body bird and they get quite stressed and they'll breathe quite quickly, and that can raise their internal body temperature, which which can be detrimental to her health. So we give them nice packages to try and keep them from overheating, which is different than a lot of our birds, which tend to get cold under anesthesia. Alright, so we put on lead so that we can maintain our radiation safety, and we have to take a lot of views for an eagle because they are a large bird that does not going to fit on our plate. So we end up having to take multiple shots to actually get their wings in position so we can get a whole view of this bird. So we're going to do that next. Our volunteer Tom will bring her in. Got it. I'll have everyone step out and then we'll get our x-rays and then we'll come back. I think all things considered, she got pretty lucky. She does have some blood in one of her eyes, but it looks like otherwise I think it looks okay. So just wait and see how things go.
Cool. Generally for something like this, how long?
Typically they'll be like in a smaller cage for at least like 2 weeks, just for everything to heal and settle down internally, and then maybe another like week or two in like a slightly larger space, like a small flight room, and then starting to fly. So maybe like a month or so before starting to fly, but kind of dependent on how she progresses. But so far, I think she got kind of lucky. Overall, I'm not seeing any obvious, on my initial scan, obvious like injuries to her bones or her muscles. She still has evidence in her GI tract and around her organs that she had some internal trauma, which is not surprising, and we knew about that from her intake x-rays as well. So at this point, I'm going to take a look into her eyes and make sure that they look okay. She does have a little bit of blood in the back of her right eye, which is something we see very commonly with birds who have had some kind of collision with a car. We'll often see trauma to their eyes, and that's why we always really check it very closely and monitor it, because the eyes are so critical for them getting back into the wild. We'll wake her up and give her some fluids as well as feed her. As you can imagine, when they first come in, it's very scary and they're hurt, so they may not want to eat, so we'll make sure she gets some fluids to keep her hydrated. Because she was under anesthesia and she's still healing, we want to support her, so we're giving her some fluids under the skin. Birds have some very thin skin, but it's very stretchy, so we're able to give them extra fluids to keep them hydrated, to help support her while she heals. This is something that we do in small animals, so if you have a pet dog or cat who gets diarrhea, this is something you may have seen done too. We're just able to do it in birds as well. As you can imagine, it's much easier to clean their feet when they're asleep, and they're less likely to grab you. Safer for everyone. She's like, I'll wake up now.
Just about to wake.
As you can imagine, waking up from anesthesia is a little unsettling, so sometimes they can be a little bit out of it, and we just make sure we keep them all supported, and we hold them until they're able to hold their head up, stand, and swallow on their own.